topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Welcome to another Ask the Experts radio show where he's right. For the last 17 years, we have brought you the top experts in the field of legal, health, financial, and home improvement. Folks, I got to tell you, this has become my favorite show. We're talking about Medicare, Medicare Advantage, but I got to tell you, I have never in my 17 years, now we have had all kinds of experts on our show. I have to tell you, I have never had an expert like Stephen Fromm, we are growing together. He has the entire, basically, western part of the United States now. And we started off in New Jersey, but if you see, I'm wearing a Fromm hat, Fromm Insurance Services hat, and I've got my shirt on. But this is the reason. This man and his wife make everything, all their promotional items, so incredible. I mean, I have never seen anything like this. Let me introduce you to our great expert. Good afternoon, Stephen.
Hey, good afternoon, Steve. Again, we always appreciate the opportunity here to educate our audience that's listening in. We always strive, always say, make a positive difference every day.
Hey,
so thank you for the introduction.
Don't butter me up, okay?
17 years of you doing this. Wow.
Okay, look, there he goes. Okay, so listen to this. So this man, my friend, in fact, he is the only one that I allow to handle my business. That's how much I appreciate him and trust him. And if you look at all the promotional items that he and his wife have put together, everything is first class. I mean, they didn't just do these promotional items. They went way beyond. And when someone can do that, it shows you how they run their business and, most important, how they're going to take care of your Medicare needs. Hey, Stephen, since we've got TikTok now, and I'm seeing all these people tuning in and listening and watching, tell people about yourself and your company.
Sure. Again, thank you very much. My name is Stephen Fromm. I am the founder of Fromm Insurance Services, and we specialize in helping families with their Medicare insurance, as well as other ancillary products that go along with Medicare insurance. We call it building an umbrella for protection. There are things that Medicare just doesn't cover, and we want to make sure that you have the right protection and the right insurance to help avoid any unexpected healthcare expenditures. As well, at the same time, we want to make sure we protect your retirement assets. Very important for us. Been doing it for 10 years now. We love what we do, helping families, making a positive difference every day.
Well, I got to tell you, Stephen, I want to really emphasize this because we have all kinds of experts. Stephen is the first expert that I have said, Stephen, I want you to handle my Medicare business. I trust him so much. And I got to tell you something, folks. One of the things I want you to get out of this show is don't call these big company ads you see on TV. And I'm going to tell you the reason why. But you need an agent, a Medicare agent like Stephen, to help walk you through this. Because when you call the companies, first of all, you're only going to get their information, where Stephen represents a lot of companies. And I got to tell you, I did some due diligence and I called one of the largest Medicare providers, and I called them 3 times and I literally got 3 different quotes. And you don't need to go through that. When you go to Stephen, first of all, you don't write him a check when you sit down with him, do they, Steve?
Our services are free. We get compensated by the insurance carriers.
And then the next thing is he's going to show you several plans to choose from, but he's not going to show them to you. He's going to do the due diligence of what is perfect for you. And I didn't have that my first time.
And that's very true, Steve. We do what's called an in-depth client needs analysis. Only the family knows what their budget is, what their healthcare needs are. There's a lot of mistakes sometimes with Medicare Advantage, particularly. What plan is good for your neighbor may not be good for you. And that's why we take the time to review your doctors, your medications, zip code driven, your travel habits, your budget, for example, just your overall history. So we get a better understanding of what's important to you. Is it going to be an original Medicare, or are we looking at a Medicare Advantage plan? And based on our client needs analysis, what we do is we make a formal recommendation to you. We say, okay, we think that this type of plan, be it original Medicare or Medicare Advantage, is going to best fit your healthcare needs today, as well as we need to plan for the future because things may change and we want to be positioned for that. Overall, as I always say, education and clarity. Those are the 2 biggest things I always talk about. Helping families understand all of their options, making an informed decision today and in the future. And my long-term goal is to become their trusted long-term resource as finally a client for life. That's what we strive for with every family we work with.
See, this is why I wanted Stephen taking care of my business, is because the way he handles every aspect of his business. Stephen, we are getting a lot of questions. I got to get this one in. It seems like the biggest question from TikTok everybody's asking is, what is the difference between regular Medicare and Medicare Advantage?
Well, that's a great question, Steve. As you know, we have you have original Medicare and then you have Medicare Advantage. Original Medicare, you have your Part A and your Part B, which is your hospital and your doctor. And they cover 80% of costs for hospital or doctors or outpatient services. And then we also look at what's called a Medigap. I call them Medigap plan or Medicare supplemental plan. What that plan does, it helps pick up the remaining 20% that is not covered by Medicare. Now, those plans are based on your zip code. The cost will vary from carrier, but Plan G is the same across every carrier. Maybe the cost is different, but each carrier has to offer the same Plan G as well as Plan N. So we do that analysis as well because there are some difference in costs for Plan G and Plan N. And then finally, we're going to enroll you in a prescription drug plan. So those are the key points of original Medicare. Part A, Part B, where there's a premium for. Then you have your Medigap plan, which is a premium for, and your Part D plan, which is a premium for. Then we talk about Medicare Advantage plans. Well, what is a Medicare Advantage plan? Well, Medicare Advantage plans are offered by private insurance companies approved by Medicare. And the federal government, well, they pay these insurance companies to administer Medicare benefits. And the plans are required to provide at least the same coverage as original Medicare. And as you may know, you're in an HMO. Those plans may include dental, vision, hearing, some gym memberships, transportation benefits, maybe over the counter. They will include prescription drugs. As you just mentioned with those commercials, unfortunately, consumers will get distracted by the extra benefits. And those extra benefits do not automatically mean you are in the best plan. And that is why we review your doctors, your medications, where you live, what is important to you. We help you understand all that. These Medicare Advantage plans, a lot of them are zero premium plans. but you still have to pay your Part B premium of $202.90. Now, that's great, but you need to understand, like we will teach you, what is deductible for the plan? What are co-pays? What are co-insurance? Do you need prior authorization? And one of the biggest things we always talk about, what is the maximum out of pocket? And I get that question a lot. And it's, Stephen, what are you talking about? I said, well, yeah, with the way these plans are designed, there is a maximum out of pocket. So maybe on the front end, it's zero premium. But on the back end, there are some exposure issues. And for the government sets a limit every year. And for in-network, for example, that is $9,250. And what does that mean? That means within your Medicare Advantage plan, you could incur costs up to $9,250. And anything above that would be 100%. Now you have your out-of-network, which is $13,900, same out-of-pocket max. People need to understand that just because there's a zero-cost plan does not mean there's no cost associated with this plans. And we need to protect you. So that's where we sell hospital insurance. These are all the in-depth conversations that I have with families, so they make sure they understand it. Had a perfect scenario today with a gentleman in Michigan going back and forth explaining everything. And one of the biggest things it comes down to travel. If someone's going to travel a lot, Original Medicare will give them that flexibility to see any doctor that takes Medicare assignment in the United States, as well as any hospital that takes Medicare assignment. And that's one of the things I always ask, a couple questions. Do you plan on travel? That's one of the very first questions. Well, the very first question is, what do you like to accomplish today? That's my very first question always. Second question is, do you plan on traveling? Because that's going to give me an idea what probably will be the most important plan or work best for them in their scenario. As well as with respect to Medicare Advantage, two types of plans typically. HMO, like you're in. Okay, with an HMO, for example, it's a network plan. Referrals are needed, some less flexibility compared to the PPO, which is a broader plan. And, some out-of-network coverage can be a little bit higher costs, but that plan is going to offer you some flexibility. So that is important to know. And then something that a lot of families are not aware of is that there's called special needs plans, which are Medicare Advantage plans. And there are we call it a CSNP for chronic needs. So if someone may have diabetes or they have COPD, this is a plan that is going to offer them some additional benefits as well as a coordination of benefits. And then we have what's called a dual SNP, and that's for someone on Medicare, Medicaid. And then you have an I-SNP, someone institutional, maybe they're in assisted living or skilled nursing. So that is all of the questions that we go through with a family to help them understand the benefits and what they think is going to work best for them.
Today I just learned something new today, Stephen. I called up. I had to get some eye ophthalmology procedure done. And I said, so do I need I'm going to get my provider to give you permission. And they said, you don't have to do that anymore. Now that's here in Florida.
That's fantastic.
Is that also nationwide?
Again, it depends on your carrier and the plan that you're in. Everything is so different. That's why, zip code's so important. When I do my webinars and my in-person, one of the things what's your zip code? That's going to be the starting point of looking at the plans in your zip code, your county or your state, for example. And, that was a big thing last year. That was a big important thing. There were so many changes last year. Now, what's going to happen this year? We don't know. But I did put a couple of quick notes together, Steve, regarding what happened last year. For example, right now, there are 35 million people on Medicare Advantage plans. So roughly 54% of Medicare beneficiaries are enrolled in Medicare Advantage plans. So what happened last year? Well, there was some market disruption. So over 3 million Medicare beneficiaries were impacted by plan terminations, maybe consolidations, or service area reduction. Now, these 3 million people, well, they also had other plans they could choose from. But it was the 30,000 beneficiaries that lost Medicare Advantage plans entirely in their service area. And they had no additional Medicare Advantage plans to choose from. So they had to return to original Medicare, and enroll in a Medigap plan. And maybe they are Medicare Advantage plans because of cost. And maybe this Medigap plan or Medicare supplemental plan, well, that is very difficult for them on their budget. How much is it going to cost each month? So this was a big movement last year. Now, what's going to happen this year? I don't know. The situation is fluid. A lot of the plans that were terminated last year happen to be
Yes.
PPO plans. Okay. The movement right now is I read, I'm always reading and studying. It seems to be the movement is more towards HMO plans. Now, what is going to happen in the fall? We don't know. But the one thing I will say, come September, when you get your annual notice of change, we call it your ANOC, you should open that because you want to know what's happening in your market with your plan.
Yeah.
A lot of people ignore that. They just throw it away. And then all of a sudden come January, what do you mean my plan changed? What do you mean my doctors are not in this plan anymore? So I stress when you get your ANOC in September, let's review it together. So before open enrollment starts on October 15th, we are already prepared. We have an idea to talk about things. Okay. Now you can't do certain things before October 1st, but at least I can say to them, okay, you have your ANOC, come October 1st, we can begin having a conversation at least. Being prepared is everything. You have to be prepared.
In your business, Stephen, education is so important. And I just want people to understand that there was probably a lot of people out there like me. I didn't know when I was supposed to sign up for Medicare. And it was really, I felt like an idiot when someone said, you haven't applied for Medicare yet. Well, it was costly not knowing that. And here you have an agent like Stephen Fromm, that's the most important thing is educating you. So I want that. My job on this show as a host is I want to make sure that everybody hires an agent like Stephen, not try to take this on yourself because, there's this age group, this demographics, which is an older demographics. We get so much junk mail. It is amazing. And I even throw away Humana stuff. Well, you know what? In some of that mail, it might be telling you that we're not going to be offering in your area anymore Medicare. And that's where Stephen comes in, right?
That is exactly where we come in. And even in the very beginning, I had two families this morning. Stephen, I just don't feel comfortable signing up for Medicare on the website. Can we do it together? Sure. So we did a joint call to Social Security this morning. We were on hold for maybe 5 minutes. The whole process took 5 minutes, and they both got enrolled in Medicare Part A and Part B. And I was on the phone with them, walking them through to make sure all the questions were answered correctly. And we were done in 5 minutes. Now, that client truly appreciates the fact that we enrolled them properly in Part A and Part B. They're going to get their card on time before their birthday. And we've already started having that conversation. Hey, what's going to be better for you? Original Medicare or Medicare Advantage plan? So we've already started that. And like I said, that was just one step of helping someone enroll in Part A and Part B. A lot of people don't know what to do. They're afraid. So we'll do it. We'll do it with you. That makes a big difference in people's lives.
So, Stephen, I'm getting a lot of questions. When do you actually, at what age or birth date do you actually sign up?
So another great question. Called at 65, called your initial election period, which is 3 months before your birthday, a month of your birthday, and 3 months after. During that window of time, 3 months before, we're going to be discussing, whether a Medicare supplemental Medigap plan is going to work for you or a Medicare Advantage plan. We usually wait for about 30 days before your birthday to enroll you in a Part D plan because something may have changed. Your prescriptions may have changed. So we want to make sure the timing is right. But honestly, right now, I've taken it a step further. I'm actually having conversations with families 6 months before their birthday. We want to get going with everything 6 months before your birthday. I want you to understand the cost of Part A. Is it free for you? Have you worked the 10 years or 40 quarters? What is the cost of my Part B going to be? Is it going to be the 202.90, or did I make more money than, and have to pay a higher Part B premium? Need to know that. What is the cost going to be if I want to choose a Medigap plan? Okay. And then, as you and I talk about all the time, there are certain things that Medicare just doesn't cover, certain non-Medicare approved or non-medical. And those 6 months before allows me to start building that ancillary umbrella, talking about the cancer, heart attack, stroke, talking about recovery care products, talking about home care products, and getting those in place before you're even enrolled in Medicare. Because you're young, you're healthy, the premiums are low, and as we all know in life, an acute event could happen at any time and change the whole scenario. So that is why it's so important we start this conversation 6 months in advance.
Our show is only 25 minutes long, so I'm really having to nitpick the questions that are coming in. Here's one I want to ask this. Thank you so much for bringing a show on like this. It is so important. People don't understand that we, as an older demographic, have so many questions about Medicare. Please tell me, what do you like best, regular Medicare or Medicare Advantage? Or is that really just up to the individual?
It's entirely up to the individual. There is no one size fit all. Only you as the family and individual know your budget and your healthcare needs. And so that's why it's so important that we do that in-depth client needs analysis to understand everything about you, build my relationship with you. That's very important. This is a personal thing. I'm going to build this relationship. And, I always say, a confused buyer is not going to buy. And I'm very detail oriented. So I'm going to explain things in detail to build everything, understand we're going to choose the right plan for you. And again, we're going to make a formal recommendation to you and to say that I think this plan, be it original Medicare or Medicare Advantage plan, will work best for you. So can't really say one's better than the other.
I want to tell everybody, it doesn't matter if what state you're in right now, except for Texas.
Well, I'm sitting here in New Jersey right now, and it's 99 degrees outside. And so it's a little hot today, hotter than Florida and Arizona, most likely.
I want to tell people, first of all, how do they reach you, Stephen?
Sure. Well, you can always call me direct on my cell phone, which is 908-268-2356. We have revamped our website, which is the www.frommeis.com. There is a contact form on there. They can fill out that contact form. It'll come right to me, and I will be in contact with them. As well as we really enhanced the website. All of your podcasts now that you and I have done since October are now on my website. Every single podcast is on the website. So somebody can go back and listen, as well as they can request a copy of the book that we co-authored. There's a spot on the website now that someone could just click on, send me their information, and we will send you a book with a lot of great information. And Judith always puts together a little goodie bag in there that you were talking about.
Yes. Hey, I wish you could see, I'm on my cell phone with TikTok because I have to have a different screen. And I wish you could see all the people who are writing in. Stephen's going to be back again with us this month, and we will let you know the date. But we are expanding Stephen's position on the show, especially for you folks in California. You're going to be so excited. We're going to be doing a California, New Mexico, Nevada show, and we will be letting you know it's going to start next month. Stephen, bro, I love you, man. You're the best.
Thank you very much for everything. We truly appreciate the opportunity to work with you, help families, and make a positive difference.
That's Stephen Fromm. We're going to go to a break. We come back, we're going to be talking about public insurance adjusting. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.